Hi, everybody. I'm here, Luis Rice. I'm a thoracic oncologist in Miami. Talking briefly about target therapy. We call them target therapy because it's like we have engineering a pill that can go straight for the target. For 20 years, we were doing empirical chemotherapy, giving the same chemotherapy to everybody. And we didn't know who was going to respond, who was not going to respond, who's going to benefit, who's not going to benefit, or who's going to have more side effects. In this case, we have been developing now, we have first of all found genes in lung cancer that are mutated, they are altered, and for that reason the tumor was developed. And these genes have popular names that everybody knows, EGFR, ALK, ROS1. And now we have at least 10 therapies approved for lung cancer. So that is very important that we target these genes with these oral therapies. In general, most of the oral therapies are non-toxic. They don't require a lot of monitoring as we do with chemo. Sometimes if you're in chemotherapy, you need to come to the hospital every 2 weeks, sometimes once a week. With the oral therapies, maybe once a month, every 2 months. And the quality of life is very good. And the important thing is the oral therapies may work for months, sometimes for years. We have patients that are on these oral therapies for years. That's why it's very important to discover if the patient is a candidate for oral therapy after he's diagnosed for lung cancer, because that can be a major, major difference in the outcome or in the survival. As I said, these oral therapies may work for months or years, and after that, we can still start the patients on chemotherapy or immunotherapy like everybody else. So that's why these target therapies are very important. We need to do a lot of education for molecular testing so we can discover if we are a candidate for this target therapy. For now, as I said, we have discovered 10 genes in lung cancer that for what we have several target therapies. For one of these genes, we have sometimes 5 or 6 pills. For other genes, we only have one approved by the FDA, but more are coming. And so that's why there is a lot of hope that we can have very good quality of life with these oral treatments for lung cancer, and that we call target therapy. And it's very important to see if the patient, as soon as he's diagnosed with lung cancer, is a candidate for one of them. Thanks for your attention.